When we hear the word cancer, it often causes our heart to drop. How much more so when we hear that word in connection with a child? September is Childhood Cancer Awareness Month. When we think of cancer, we often think about it stemming from some sort of behaviors, for example, lung cancer and smoking, or cirrhosis of the liver and alcohol use disorder. The types of cancers that often occur most often in children are different from those seen in adults. The most common cancers of children are leukemia, cancers of the bone marrow and blood, which account for about 28% of all cancers in children, brain and spinal cord tumors, the second most common cancers in children, making up about 26% of childhood cancers, neuroblastoma, a type of cancer that starts in early forms of nerve cells found in a developing embryo or fetus. It accounts for about 6% of childhood cancers. Wilms tumor, a type of kidney cancer that is most often found in children aged 3 to 4 years old and is uncommon in older children and adults. Lymphomas, cancers that start in the immune system cells called lymphocytes. This accounts for about 5% of childhood cancers. Rhabdomyosarcoma, a type of cancer that forms in soft tissue, as in a muscle, and can occur anywhere in the body. It accounts for about 3% of childhood cancers. Retinoblastoma, a rare type of eye cancer that usually develops in early childhood, typically before the age of 5. Bone cancer, a rare type of cancer that can occur in any bone, but most often occurs in the long bones of the arms and legs. I've heard it said that we all have cancer cells in our bodies. More accurately, we all have many different types of cells in our bodies that serve many purposes, and some of them may become cancerous. Cancer happens when cells that are not normal grow very fast and spread. Normal body cells grow and divide and know to stop growing. Over time, they also die. Unlike these normal cells, cancer cells just continue to grow and divide out of control and don't die when they're supposed to. Cancer cells usually group or clump together to form tumors. A growing tumor becomes a lump of cancer cells that can destroy the normal cells around the tumor and damage the body's healthy tissues. Sometimes, cancer cells break away from the original tumor and travel to other areas of the body where they keep growing and can go on to form new tumors. This is how cancer spreads. The spread of a tumor to a new place in the body is called metastasis. Cancer disparities in the African American community are a significant concern. African Americans face greater obstacles to cancer prevention, detection, treatment, and survival compared to other racial ethnic groups in the United States. Research has shown that we have the highest death rate and the shortest survival for most cancers. For instance, African Americans are about 20% more likely to get colorectal cancer and about 40% more likely to die from it than most other groups. We also have the highest mortality rate of any racial and ethnic group for all cancers combined. Regarding childhood cancers, the American Cancer Society provides comprehensive information about cancer disparities in the African American community. Childhood cancer survivors often face anxiety about cancer returning and find it challenging to transition back to normal life. The treatment of cancer in children typically involves surgery, chemotherapy, radiation therapy, and bone marrow or stem cell transplant. Newer types of treatment like targeted therapy drugs and immunotherapy are also becoming increasingly important for some types of childhood cancer. For more information on childhood cancer treatment, you can visit the American Cancer Society's website. Another good source of information is St. Jude Research, which focuses on childhood cancer. As always, feel free to reach out to me, Dawn Daly-Mack, RN, at 252-410-1717 with any questions regarding the information I shared today. And remember, Black health matters.